talk about something else that's also very dear to our hearts. The word cancer invokes deep fear as a silent killer, with many viewing this disease as a symbol of grief and pain, a plaguing straining our intellectual and emotional resources. The estimated number of deaths due to cancer in 2018 was 9.5 million, which amounts to a whopping 26,000 deaths a day. This number is expected to increase as environmental stresses increase, also air quality worsens, and lifestyles and eating habits too. It's World Cancer Day today. The theme is I am and I will. Very empowering, and it's a call for personal commitments and represents the power of our actions taken now to reduce the growing impact of cancer. We'll try and figure out where our own data stands, knowing that it's always very difficult to get the national data on cancer. But we want to have the conversation because there's also a scary trend now in our country. We're hearing of head and neck cancer, and we'll get more on this. My guest is Dr. Verna van der Poy Anaglate. She's consultant oncologist with the Kolebu Teaching Hospital. Good morning to you, Doc.
Good morning.
Thank you for being here. I am and I will. What does that say to you, I am and I will, when it comes to cancer?
I think it's mainly the banner by the Union International Cancer Control, and it's to put all of us in the middle of cancer control. That's right from the beginning of early detection, prevention, all the way to cure. So everybody should be an advocate, all survivors should advocate, and everybody should be in the middle of this to push for early detection through education and awareness.
When it comes to breast cancer, I know that Kolebu does pretty well every year to try and get survivors to share their stories. But generally, is it an easy thing to get survivors to tell their stories?
It's very difficult because we have a lot of socio-cultural hindrances. People don't want to be the face because everybody has a funny idea about what cancer is. It means you're dying tomorrow. But I think that's where we need to work on, for people to see that cancer now is almost considered a chronic disease, and it can be cured when detected very early, and that is what we really have to push. Breast cancer is curable when detected early. There are different types of breast cancer, so I think we shouldn't be fatalistic about getting the right treatment at the right time in the right sequence.
Okay.
That is what the issue is with breast cancer.
Tell us about this head and neck cancer that you're beginning to discover is becoming a trend, particularly from the Kolebu point of view. Okay,
so head and neck cancer is quite easy to detect because you have a sore throat, you have a bump on your neck. But for some funny reason, we have a lot of tuberculosis as well. So there was a lot of confusion about what the diagnosis is. But now with the availability of a lot of options in terms of technology, we're able to diagnose it quite early.
Okay.
There are different types. It's all the way from we call the oropharynx, the throat, the mouth, everything, the voice box is all considered head and neck cancer, and even in the sinuses. The issue here is there's a new trend where we have the human papilloma virus, HPV, which was originally associated with cervical cancer, anal cancer, vulvar cancer. We realized that it's actually causing a lot of throat cancers in young people.
Okay.
Before, you used to have head and neck cancers occurring more in like middle age or 60-year-old and above. But now young people are contracting the HPV through oral sex and all kinds of things, and it's increasing their risk of developing these throat cancer. But I think the awareness is not really out there.
Okay.
Because people just think I'm young and therefore it couldn't be a cancer. Not only just the public, but also the health professionals also need to be educated that when you have the signs and symptoms, you need to be alert that it could be a possibility.
Okay.
I think that's what's missing in our society. That being the index of suspicion for cancer is quite low. And I think that needs to change because it's much commoner than we think.
Can we spend a bit of time on the signs and symptoms with this they're talking about the head and neck, yes.
Okay, so head and neck cancer, the thing with cancer is that anything that is unusual needs to prick your mind that there is a possibility. But don't forget that it's not as high as we think, but it's curable and it's deadly if found late.
Okay.
That's what because it's like a wide gap. So if you have like a sore throat, difficulty swallowing, a sore throat that stays on for a while, you take antibiotics, it doesn't go away. You see a growth in your mouth. You can't swallow, that while you are spitting out blood. You have pain in your jaw or in your neck, and it's something that should, have a suspicion. The problem is that we end up in the wrong places. The ideal thing is to go to the health services center. And there's one thing that Ghanaians don't realize is that you should actually ask for a second opinion when you are not happy, because it happens a lot when the patients say, well, I suspected it, but the health practitioner said it wasn't, so I let it go. But it really hurts that I wish I'd asked for a second opinion.
Yeah.
So you should still persist if you think that it is something that is unusual. Most people end up seeing their relatives and their friends when they are unwell, and I think we need to try and desist from that, because then the index for suspicion is always much lower. So I think if you have a persistent symptom, you should need to, because we are all young, everybody has sexual adventures, maybe in the past, in the future, or with your partner. You don't know what has happened before. So it's something that so apart from alcohol and tobacco, that was the biggest thing as increasing your risk of throat cancer. Now we have HPV infections as well.
Okay.
So
you're not discouraging people from having oral sex, are you?
No, but you just need to be informed, and then you are wiser.
Does kissing also contribute, because it's all through?
Yes, it does.
Okay.
Yes, it does. So it's something that you need to be aware of. I'm not asking you to check whether the partner has HPV or not, but you just need to be careful to know who you are with. I think it's something that needs to be,
So when it comes to the throats, I'm thinking that naturally the first point of call, if there was some discomfort in the throats, if there was some pain, you'd go to the pharmacy. Hardly would you want to visit the hospital proper, because, if you have sore throats, you get some tablets, just and then it will go away.
Yes.
So between the time that you go to the pharmacy and then if it persists, you go to the hospital, between that time, at what point do I get a second opinion? Would it be too late? Essentially, that's what I'm asking.
I think I'll look at it from the cultural point of view. I do the same, unfortunately. So the first thing we do is that it cannot be. So you go to the pharmacy. It depends on which pharmacy. Some people take it upon themselves to manage you, which actually is not really right. But it's cultural, so I wouldn't complain about that. So you take antibiotics for a week. You take another one for another week. You see this thing is getting worse. Usually colds should heal within 2 weeks maximum, 10 days to 2 weeks. But if it persists, then obviously there's something wrong. It could also be just an infection. But infections come with a fever and whatnot. But this doesn't have a fever. You are spitting blood. It's more and more difficult to swallow in this persistent pain. And unfortunately, when you start losing weight and have nodules in your neck, it's a little bit too late. So I think about a month is the latest.
Okay.
Which you need to seek special care.
If I have sore throat and I walked into Kolebu, would they naturally refer me to your department?
No, it's an ordinary medical problem. It doesn't need to be seen. So it's the persistence of the system that we tend to ignore a lot in Africa. Even a breast lump, we tend to, it's there for a month, 2 months, and then we keep binding it and, and totally ignoring it. I think that's where our problems are in Africa.
All right. Kolebu, what are the statistics? Are you now getting statistics from elsewhere that you're combining to your own, or it's still your own statistics?
Kolebu is now involved in what we call the Accra Cancer Registry. So they're collecting data from different parts of Accra as well. It's not an easy task to do, but we are getting there because we realize we have to have a population base which tends to be more substantial in planning our future, what we do with the cancers. There is a cancer plan. It's been rolled out, but I think every now and then it needs to be renewed, and that depends on the strength of the data we have. And obviously it's better if we have a bigger coverage area, like you said, and catchment area. So this is being worked on quite seriously to get more data.
So are there other statistics to give out?
Not yet, but a few things have been published. Head and neck is about the fourth to fifth commonest cancer right now, from the data that is being collected. Kumasi also collects its own data. The differences are not that much. So we have like breast, cervix.
So breast is number one?
Breast is number one in females. But you also have the liver cancers that nobody seems to really talk about.
And the stomach.
And the stomach is also really coming up. So the thing is the catchment area, diagnosis. I think the stomach cancer has always been there, but there was no endoscopy. And again, for the same reason, the suspicion of the index of suspicion is low. So you get treated for ulcer for a while before they figure out, let me have a look in the tummy to see what is going on. Same with colorectal cancer. You're getting quite a few of that, even in younger people, because ideally everywhere else we are supposed to have a colonoscopy at 50. I'm 54, I haven't had one yet. But it's just a cultural thing. I think that nothing is going to happen. But I think we encourage everybody now, as advocates for cancer, to do the right thing. Get your mammogram once a year, once every 2 years, especially when you have a family history. Examine your breasts. Just pay attention to your body. Anything that is unusual, you need to get a colonoscopy or at least a stool blood test at the age of 50. It's very important. The thing is also educating the health professionals. I think that is a big gap that the government has to really look at, because we have a lot of people stay with their physicians for a year with bleeding from the rectum. Everything is cocoa and pals, but it doesn't. Or when it's 50, the suspicion of index has to be high. Like I'm saying now, before, if you were 25 and you have a throat mass, the last thing I'll think about is a cancer. But now the evidence now shows that there's a risk of younger people getting, it's difficult to ask that history.
Yeah.
What have you been doing in your sexual life? Because again, we have cultural limitations. But I think it doesn't limit us from, thinking about these things, and getting early detection equals cure.
Are we making progress as a country?
We did for a while, because there was a lot of work that had been done, but I think we have actually gone backwards. We are seeing a lot more advanced cancers because people like to believe that there are other solutions to cancer treatment, because everybody zones in on the side effects and the costs. But sometimes out there, the costs actually might be higher than what you come in orthodox medicine. With orthodox medicine, there's a lot of trials. We treat with protocols and trials, things that have shown to work from thousands of patients in these treatments, to see if you do it this way, this is what your expected outcome. Of course, it's difficult because we have limited resources. We don't have resources like these countries that have these big studies, but we know how to adjust, and we have a lot of experience. Radiotherapy Center, where I work, has been there for 20 years.
Okay.
So obviously we have experience with, managing cancers based on our cultural perspective, based on financial perspectives, and out of pocket, and what does. But other people tend to, bunch up on these and do all kinds of things in the name of curing cancer. It's negative because they come and there's nothing that you can do about it. So I think everybody has to be sensitive. It's a sensitive topic to tell somebody. People just come out bluntly and say, I want to do something else. And it's their right, actually, but I think it should be an informed decision. So you need to educate your patients. And then,
how many of the people who walk in who discover they've got cancer actually come back?
I'll say we did a few studies for Wilms tumor, cancer in children, cervical cancer, and vulvar cancer. And we realized that half of the people who were referred to the National Center of Radiotherapy actually don't come back for their treatment. And actually another...
So where do they go then?
That is the big question. We don't really know where they go. But there are a lot of people who claim to cure cancer, and all kinds of, but it's nothing. I don't think there's much that you can do about it. I heard on the news once where I think there was a government ban on people advertising that they can cure cancer and other diseases. But after that, I haven't heard anything else, and people are still, doing this. I think if a lot of countries have tried educating the traditional healers to be able to send cancers to the health organizations. But I think we need to do a little bit more on that, because most of our healthcare system actually is in the traditional health system, and we have to find a way of integrating them for them to understand the science behind it. I think that is what is missing, the science. We are more spiritually inclined. I think that's where it's simple, it's easier that way. But I always say, once it manifested in the physical, you need to take care of it, and then take care of it spiritually as well.
Yeah.
Yes, it's very important.
Sure.
Yeah.
So cancer is no longer a disease for the elderly, because it could happen to anybody.
Unfortunately, so it happens to a lot of young people now. In fact, yesterday on the BBC, they were telling us how young people now have a 6 times rate of cancer that are associated with obesity, because most of our young people are obese at a very younger age. Most of us got obese, past our 40s, but in their 20s and teenagers, they are obese. So we have breast cancer, colorectal cancer, all kinds of cancer that are associated with obesity. We have a higher risk of that now. So now it's not unusual. You have young people with breast cancer. There's also the family history issue. There's also all kinds of practices, even our food, the way we prepare our food, the way it's burnt with Thai, that has a lot of carcinogens. You know, but I think our daily practices.
But we still like it.
I know, but once I saw that, I actually stopped eating Willie. Yeah, but I think does it change because I don't know what the red oil is made from. So you kind of like reduce your risk, but it's not like 100%, you know, per se. But I think it's education is the way. The other people who prepare Willie another way. So it's education. We are all missing that part. You know, it comes in, we eat it, we enjoy it, but I think we all need to, you know, advise ourselves.
You work at as a consultant oncologist. If you're told you have cancer, is this something that can be managed or treated from the beginning till you're okay in Ghana, or you have to start saving and going to South Africa or elsewhere?
I don't think it's really necessary. There are some times where it's peculiar, where maybe the intervention that you need is not available. But even that is, like I said, we are becoming more and more technologically advanced. Things are getting better. So right from the beginning, you can be managed. It's even simpler when it's diagnosed at an earlier stage. Maybe all you need is surgery, all you need is a tablet, all you need is maybe just radiotherapy. It's simpler than when it's advanced. And the chances of cure becomes less and less the bigger the diseases, the burden of the disease. So if it's spread to the lymph nodes, it's spread to the other organs, and your chances of being completely cured are less. But compared to, I've been working for almost 20 years at the radiotherapy center, and people even with metastatic disease that spread to the other organs, stage 4, who used to pass within 6 months or a year, are living 3-4 years. So things actually are better. The drugs are getting better, they are getting more advanced, and they are able to cure more people. So I think we are managing it as a chronic disease. So that's what a lot of my cancer patients don't die from the cancers, they die from other diseases like hypertension, strokes, and diabetes.
Okay.
So I think we need to let down the fatalistic, you know, attitude to
Just
cancer.
a final one. How often do you tell your patients you're free from cancer, and then they come back and you realize the cancer appeared somewhere else?
There's always that possibility. And there are a lot of things that you could do after a diagnosis of cancer. Like, for example, when you have breast cancer, you should reduce your weight, eat more fruits and vegetables, eat less meat. Even the same with colorectal cancer. But it's something that, you know, it's quite difficult for people to understand. So it depends on if you are early stage, most likely you are cancer-free. But I'll tell you, you also have a risk of developing other cancers, don't forget. So you still have to come for your follow-ups. You need to be aware of yourself, you know, to make sure that it still comes back even for stage 1 in about 10 to 5% of patients. So they just have to be aware of this. People have had 3 cancers recurring, and they are still alive after 10, 15 years. So it's about listening to your body and taking care of yourself.
Okay. Anything special happening today at the oncology departments?
Not that much. You know, we have so many patients, so we are treating, you know, but we are trying our best to put out YouTube videos and whatnot on our website.
Okay,
so, yes.
All right. I'd like to say thank you for the education this morning. Dr. Werner van der Poy Anaglate is consultant oncologist at the Kolibu Teaching Hospital.